had some personal experiences foster parenting, which gave me a view of the child welfare system from a different angle and really inspired me to want to learn more about the child welfare system and how we can improve it. The Kansas Intensive Permanency Project, it was part of a federal initiative known as the Permanency Innovations Initiative. Locally, we got to implement in a public-private university partnership, so we involved the Department for Children and Families and the private providers of foster care in Kansas, and then of course us here at the University of Kansas School of Social Welfare. But it was really a strong collaboration between all of those entities. Which really hadn't happened in Kansas before with privatization and child welfare. So it was really one of the first projects where the private agencies agreed to cooperate and even more than cooperate, to collaborate and do things in a similar manner. What we did, we got a whole year of planning to identify who were the kids who were most at risk of long-term foster care. So we did all kinds of data analysis, both qualitative and quantitative data analysis, and we found out that kids with serious mental health problems, social, emotional, behavioral problems, were the kids most at risk of being in long-term foster care. So they were 3.5 times more likely to be in care for 3 years or longer compared to their peers without serious mental health problems. We decided to implement an evidence-based parenting intervention, parent management training Oregon model. And although there's been quite a lot of research on parenting interventions, not a lot of it has been in child welfare. And what had been in child welfare was mainly with foster parents and birth parents who either were at risk of their kids going into foster care, or parents who already had their kids back after their kid had been in foster care. So ours was unique that we wanted to work with parents while the kids were in foster care and early on in their foster care stay. So our hypothesis was if we intervene early with the birth parents and we engage them, really truly engage them, that we could keep the parents and kids connected and get the kids out of foster care more quickly. So that finding that the parenting intervention could have positive effects for kids when we're not even focusing just on the kids, we're focusing on the family, was important findings. And demonstrating how you can implement in that way and how you can evaluate in this staged approach was an important aspect of the project.